death in Harare. Crumbling infrastructure led to the 2008 outbreak and infected over 100,000 people. While deadly, the disease is easily preventable with clean water and proper sewage. Southern Africa Director at Human Rights Watch, Disege Kasambala, says Harare's water and sanitation system is broken and the government is not fixing it. Many residents say lack of household water forces them to wait for water at boreholes for up to 5 hours a day. And they say when there are long queues, violence frequently erupts. People believe the boreholes, 200 of which were drilled by international agencies during the cholera epidemic, are the safest water option available. But 1/3 of the boreholes tested in Harare showed contamination.
Now, to discuss this issue, we joined in studio by Diwa Mavhinga, the senior researcher on Zimbabwe at Human Rights Watch. Diwa, good morning to you.
Morning, Elvis.
What is the situation like on the ground? Now, you've just witnessed it firsthand in Zimbabwe.
There is a severe water crisis in the capital of Zimbabwe, Harare, where people do not have access to clean, safe, potable water, and there are open sewers flowing on the streets, as well as Harare residents in the capital being forced to defecate in the open. So it's an extreme situation where there are risks for another outbreak of a cholera epidemic, similar to the one that we witnessed in 2008, when over 4,200 people were killed and over 100,000 people were infected with the disease.
Now, what are the reasons for this?
The reasons are numerous, including the ballooning of the population of Harare, so there is extreme overcrowding, but also public sector corruption, mismanagement, and lack of political will to decisively deal with this challenge. Resources meant for water purification and for expanding the water infrastructure are being diverted to pay, for example, salaries for public servants. So there's a lack of priority to address this epidemic and crisis.
So what you are saying or suggesting is that water, or clean drinking water, is not a priority for government?
It appears from the way the resources are being used that it's not a priority. It has been known by the government since independence in 1980 that the population of the capital would be growing, but there were no efforts to properly maintain the infrastructure and upgrade it to cater for the growing population.
Is it only in Harare?
It is across the country, but the challenge is biggest in Harare, where there is the highest concentration of people, and the millions of residents of Harare are at risk of contamination and suffering from the waterborne diseases such as cholera. And now, over the last year, over 3,000 people in Harare suffered from typhoid, which is a new waterborne disease that is now a challenge in Harare as well.
If the situation is left unchecked and nothing is done, what is the outcome?
It will be a huge epidemic of cholera as well as typhoid. We are approaching the rainy season in Zimbabwe at the moment, and in terms of the risks, another challenge is also that the health delivery sector has no capacity to deal with this immense challenge.
Now, you've mentioned the figures earlier of the earlier outbreak in 2008 it was?
Yes.
Now, what can we expect, or how many people could be infected this time around if there's an outbreak?
Potentially, we are looking at thousands. It could be a bigger outbreak than that was witnessed in 2008, because there have been no efforts since 2008 to properly address the challenge. There have been some piecemeal responses, for example, from the UN agencies, including the drilling of boreholes to supply safe water. But these boreholes are not safe. 33% of the boreholes have the water contaminated. So the efforts to address the challenges have not been dealt with properly, and the conditions that prevailed when there was this first outbreak continue to prevail at this day.
Now, whilst doing research in Zimbabwe, in Harare, you spoke to some residents. What are they saying about the situation?
Well, residents are confirming that the situation is dire. Women and girls particularly are affected because they spend hours in a day queuing to get water from boreholes. Some have dug shallow wells in Harare across the city from which they get water, which is not safe to drink. The Harare City Council continues to charge huge bills on a monthly basis for water that is not available in the tapes. So this is the challenge that residents are facing, and they're extremely frustrated. Their dignity is also a huge issue here. Being forced to defecate in the open, in public, that really compromises not only health, but also dignity.
Are they aware and afraid of a possible cholera outbreak?
Yes, but another challenge is that there is also a suppression of information. There is lack of access to proper information. For example, a number of residents believe that water from the boreholes is actually safe to drink and use, when in fact it is not safe. 33% of the boreholes are contaminated because the water is mixing up with the sewage, which is their burst pipes, the infrastructure is collapsing. So residents do not in fact know that the water that they think is clean and safe is in fact contaminated and exposes them to cholera, typhoid and other waterborne diseases.
Have you spoken to officials, health officials in Harare?
Yes, we have spoken to officials at the level of the city council, at the level of health officials, who are also expressing this challenge. But at a bigger level of the political leadership of the country, there is denial that this is a big problem. There is denial that resources are being misused. So hence the lack of political will to decisively deal with this thing.
What are some of the possible answers here, Diwa?
Well, there is need urgently for political will and for the deployment of resources that are meant for water to secure water purification chemicals, to drill more boreholes that are safe to use, and also in the long term to upgrade the infrastructure. But also what you need to look at is there are some cheap solutions that can be employed. For example, the harvesting of rainwater, which is purified and made safe to drink. But these initiatives are not being looked at the moment.
Diwa, thank you so much for your time. Now, that was the senior researcher, Diwa Mavhinga. He is the Zimbabwe, senior researcher on Zimbabwe, rather, from the Human Rights Watch. But right now,